Yes, that's exactly right, Bev. The bottom line is that China is going to have a difficult road ahead, but it can be a managed one or a catastrophic one. And if we're realistic about it, we probably will have difficulty knowing exactly which one it is, and we can come to that. But what they've made the changes on is that, first off, that people with COVID can isolate at home with mild or no symptoms, and you don't need to show tests now for most venues, and travel has been relaxed quite a bit. The challenge is, of course, this is going to mean an uptick in cases, and some studies have looked at the potential of up to between 5 and 6 million people admitted. That could mean 1 million deaths. Whenever you have cases go up, you have deaths. The challenge will be to protect the most vulnerable and to do it in a managed way. But China has numerous challenges in that related to vaccination rates and also its primary healthcare system.
Yeah, so let's talk about those. The vaccination rates are not what they should be, and they've only really used their own vaccines, which everyone has said are just not that effective.
That's true. And in terms of this particular wave, China has until just recently managed COVID Omicron, which is our current dominant strain throughout the world, as if it were still managing the Alpha and Delta strains earlier on. And it's just too infectious. You just can't do that. But we should recognize that this is as much about vaccination rates and health as it is about the Chinese economy. Some of the November data coming out of China shows that the biggest dip in exports and big dip in internal demand. And so obviously the global recession and problems have played there, but internal demand has been very low, and that's all to do with COVID restrictions. So the vaccines have not been as effective. We should recognize in the West that we're still vaccinating numerous times every 6 months. So clearly we need to come to more effective vaccines globally. But the issue also will be, can they shift these mild cases to being treated in primary health care? That's a big question.
Yeah. And as you say, we'll talk about that in a moment. I'd love to get your thoughts as to whether they are, they've become so closed, China, and so proud about how they're managing this. How closely are they taking advice, do you think, from organizations like the WHO?
There has been a lot of exchange. There's regular exchange with the WHO. One of the last things I did before COVID broke out when I was still at WHO, I was involved in the review of the China healthcare system, where we provided a whole review of their 10-year plan. So there's a lot of exchange back and forth. How much sinks in and what China does is China's choice solely. And you could see, even as countries that had not exactly the same, but similar policies, Australia, New Zealand, about minimizing or zero COVID policies shifted, and even later ones like Singapore, Hong Kong, the spike upward in cases has been inevitable, but managing it has been something that China has kept under wraps. And I think we shouldn't have any illusions that the current caseloads and current death numbers are exactly what is happening in China.
Yeah, so, as you pointed out from the beginning, we don't really get that sense as to how honest they're going to be with how they manage this from here on in. The population size, as you point to, is just going to, with the Omicron variant, probably be highly contagious. What support do they need? Will their health system in any way manage to cope with the numbers that could suddenly be presenting for care?
Well, China has this interesting issue that in some ways is emblematic of a number of other countries around the world that are looking to transition to a high-performing health system. They've invested a lot on hospitals, and for years, WHO and others have told them to strengthen their primary healthcare systems, and that hasn't been done. They still, though, even at the hospital level, only have about 4 per 100,000 population ICU beds. If you look in the US, we have around 35, France around 12, so many times more. So their ability to absorb these numbers is going to be very difficult when you can't keep lower level infections at primary healthcare level and even with community care programs.
Interesting. You know, it's interesting about this vaccine hesitancy. You've just come back from Kenya, where you've been trying to get people vaccinated after 3 years of this virus. People are still hesitant. They presumably have not been shut down. Give us the sense of the difference when a community has been open but still hesitant. How is it impacting?
Yeah, fascinating. Thank you for asking that, Bev. Fascinating program. We're out there actually looking at a related program with ApiJect on injectable contraception, but also investigating, because it's the same supply chain. Sometimes people, when these pandemics happen, act as if there's two health systems, one to respond to the pandemic and then the other one that fixes broken arms and delivers babies. Obviously, it's the same one with the same health workers. And in Kenya, it's an example of where we made big mistakes globally, I think, which was first, very little resources vis-a-vis the amount we spent on vaccine development devoted to delivering the vaccination. So you had not enough effort on information provision, tons of rumors and misinformation in Kenya and many countries in Africa about the vaccines. You had late delivery of doses, things showing up with 3 months before the expiry date. That's not even 2 or 1 month. That's not enough to get it from the central storehouse to regional storehouse to the, in Kenya's case, county storehouse, and into people's arms eventually at frontline health facilities. And then we didn't have enough support for the health workers who would vaccinate, for the syringes that would be there, and the refrigerators who actually need to keep the vaccines safe. But many of these countries, just to finish, are looking at what happens next. US and Europe included are looking, do we integrate COVID with influenza vaccination programs? Well, those don't exist in many parts of the world. You don't have an adult vaccination program in Kenya. And so they're struggling to figure out where they would go. We were in many frontline facilities where the health nurses were out there trying to convince community gatherings to come and get a free vaccine right there as they were already gathered for some other work, and people didn't want it. It'll be very difficult to move COVID vaccination forward in much of the world in 2023.
Yeah, so interesting. Ted, great to have you on as always. Really fascinating. Thanks so much.
Thank you, Bev.